So you've spent thousands of dollars, you've seen every specialist, your child's diet's cleaner than most adults, your supplement cabinet looks like a pharmacy, and you're doing occupational therapy, speech therapy, behavioral intervention. You've hired a functional medicine doctor. You're following the protocol perfectly, and your child is still stuck. Or worse, they've improved for a while and then plateaued, or they're backsliding. The seizure threshold drops again. The meltdowns are returning. Brain fog won't lift. Congestion's never clearing, and this is what nobody's telling you. Sometimes the problem isn't that you need to add another therapy. Sometimes there's a hidden environmental toxin that's sabotaging every single thing that you're doing. And one of the most overlooked culprits destroying kids' nervous system right now is mold. But here's the part that'll piss you off even more. Even if you find the mold and remediate it, your child still won't fully heal unless you address the nervous system damage that it caused. So this video is for the exhausted parents who are doing everything right, but still feel stuck into the mud. For families that have invested heavily in functional medicine protocols, in detoxes and therapies, but aren't seeing the progress that they expected. For the parents that suspect mold might be an issue, but don't know what to do about it. Or those that have already remediated mold, but their child still isn't getting better. Now, in this video, what we're going to learn is why mold toxicity keeps kids stuck despite excellent care. How mycotoxins hijack the nervous system and create the damage that persists even after the mold is removed, and why most detox protocols fail or make kids worse. And the critical piece that functional medicine and conventional medicine both miss entirely. You cannot detoxify a dysregulated nervous system. So you're going to learn the exact red flags that should make you investigate mold, why neurologically focused chiropractic care is essential to repair the nervous system damage before any detox or remediation can fully work, and what actually needs to happen for your child to heal and not just manage their symptoms. Now, I can't tell you how many times we see this exact pattern. Parents come in, they've been working with a functional medicine provider, they've spent 8 to 15 grand on supplements and special diets and detox protocols, and they found mold in their home. Spent another 20 to $200,000 on remediation, and the mold's gone. The house is clean, and their child's still struggling. Maybe 20% better at best. Maybe not at all. The parents are devastated. We did everything. We found the mold, we fixed it. Why isn't our child better? And this is why mold doesn't just trigger reactions while it's present. It creates nervous system damage that persists long after the exposure stops. Now, mycotoxins cross the blood-brain barrier and they irritate the brainstem. They impact our vagus nerve and the autonomic nervous system, and they lock the nervous system deep into sympathetic dominance, or that fight or flight mode. And once that happens, the body cannot detoxify effectively. It cannot regulate inflammation and it cannot coordinate healing no matter how clean the house is. Now, the missing piece isn't another detox protocol. It's repairing the nervous system so that your child's body can actually do what all of those therapies and protocols are asking it to do. So listen, mold is actually a neurotoxin that damages the nervous system. However, most people think of mold as something that affects the lungs, causes allergies, builds up on our cheese or our bread if we don't eat it in enough time, right? And it's not wrong, but it's dangerously incomplete. So mycotoxins, which is the toxic byproducts that mold releases into the air, those are neurotoxins. They cross the blood-brain barrier and directly damage brain tissue and nervous system function. And this is what happens. Your child breathes contaminated air. That mycotoxins then enter the bloodstream, they cross into the brain, they create oxidative stress and inflammation in brain tissue, and then the brainstem and the vagus nerve become inflamed and irritated. So your autonomic nervous system gets stuck in fight or flight mode, and then this dysfunction persists even after mold exposure stops. Now, the brain uses 20% of your body's oxygen, despite only being 2% of our body weight. So when mycotoxins interfere with oxygen utilization and create inflammation, neurological function crashes. Brain fog, attention difficulties, emotional dysregulation, sensory processing, and even sometimes seizures. But these aren't separate issues. They're all manifestations of a nervous system under toxic assault. Now, research shows that mycotoxins have a particular affinity for the brainstem and the cerebellum, the control centers for coordination, for balance, for sensory integration, and for autonomic regulation. And when these areas are impacted and damaged, you get these scattered, inconsistent symptoms that don't fit into one nice, neat diagnosis box. And this is the challenge. Even after mold is removed, the nervous system actually remains damaged and impacted. And this is the brutal truth that functional medicine doesn't even touch, is that removing mold from the environment doesn't automatically repair the nervous system damage that it actually caused. So think about it like this. If someone gets in a car accident and they break their leg, removing the wrecked car from the road doesn't heal the broken bone, right? The injury actually remains until it's specifically addressed and repaired. So this mold exposure creates chemical stress, which then leads to subluxation or the dysregulated nervous system. It chemically impacts our vagus nerve, creates the irritation, and suppresses its brake pedal calming function. And then this builds into this chronic sympathetic dominance where our gas pedal stuck on and parasympathetic exhaustion where the brake pedal is actually burned out. So then we're left with brainstem inflammation and overall dysautonomia. Now these dysfunctions, they don't magically resolve when you clean your house. They require specific neurologically focused intervention to actually repair. And this is why when families spend 20 grand plus on mold remediation, they'll still see minimal improvement. The environmental trigger is gone, but the nervous system injury is still remaining. And this is where both conventional medicine and functional medicine miss the boat. You cannot detoxify a dysregulated nervous system. You see, the nervous system is what controls detoxification pathways. The vagus nerve specifically coordinates our liver detoxification, our lymphatic drainage, our kidneys eliminating things, the intestinal or digestive movement and motility, as well as our immune responses in managing inflammation. And when the nervous system is stuck in sympathetic dominance, which is exactly what mold toxicity causes, these pathways don't work properly. So when functional medicine doctors immediately start throwing detox protocols and binders and glutathione and all these supplements at kids whose nervous systems are so dang dysregulated, what happens? Kids actually get sicker. We start seeing Herxheimer reactions. There's behavioral regressions, sometimes increased seizures, big meltdowns, big brain fog, big anxiety. But parents are told that it's the toxins that are coming out or that it gets worse before it gets better. But that's not what's happening. What's actually happening is that you're asking a body that's stuck in survival mode to do complex metabolic detoxification work that it doesn't have the neurological capacity to coordinate or to handle. You're trying to detox through a broken drainage system. This is why families that spend thousands on detox protocols and then they either see no results or their child gets worse. You see, the sequence is backwards. You have to repair the nervous system first, and then the body can actually respond to that detox support. So, mold toxicity rarely happens to a child with a pristine, resilient nervous system. It becomes the environmental stressor that tips an already compromised system into complete dysfunction. So, we call this the perfect storm, which is the sequence of stressors that get our kids stuck and more vulnerable to these big time environmental stressors. And the first is prenatal stress, because maternal stress during pregnancy. Maybe there's fertility treatments, there's medications, there's birth control. When mom experiences chronic stress, elevated cortisol crosses the placenta, and babies born to highly stressed mothers enter the world with nervous systems already tilted toward that sympathetic dominance, where their gas pedal is already stuck and sensitive. And then we have interventions or birth trauma from C-sections and forceps, vacuum extractions, prolonged labor inductions, and epidurals. Now, this creates physical and chemical stress to the baby's delicate nervous system, primarily the upper cervical spine, the upper neck, brainstem, and our vagus nerve, because it's physically and chemically sensitive. Now, this is what creates stress and subluxation, or the neurological interference that presents proper nervous system communication. See, the brake pedal is actually damaged and impacted from day one. And then this feeds into the early childhood stressors, where there's repeated ear infections, there's significant antibiotic usage that then damage the gut brain axis, that creates poor sleep, our digestive issues. There's vaccines and medical interventions and emotional stress, academic pressures and social demands. Every single stressor without adequate recovery time prevents the nervous system from returning to baseline. And then now you layer in the chronic mycotoxin exposure on top of this already compromised, already dysregulated nervous system. The child doesn't have the adaptive reserves left. You see, mold then becomes the accumulating stressor that pushes them from struggling but compensating to completely stuck and unable to heal. And this is why some kids in a moldy house seem fine while others completely fall apart. It's not about who has the stronger genes or the stronger immune system. It's about who already had a nervous system running on empty when that mold exposure hit. So investigating mold is crucial for these families, for these kids, if you start to see some big pattern changes. Like your child does better when they're away from home, like symptoms are improving at school or on vacation, they're at a relative's house, and then worsen when you're returning home. The nervous system is literally telling you that the environment is the problem. You start seeing what's called the triad, the chronic congestion, the behavioral dysregulation, and the cognitive dysfunction. Because when respiratory issues and mood problems and brain fog appear together, it strongly suggests that systemic inflammation from the environmental neurotoxins are present. Maybe you start to see that multiple body symptoms are affected simultaneously, not just respiratory, not just behavioral, not just immune or not just digestive, but all of them all at once. And this is the hallmark of nervous system dysfunction that's affecting every system it controls. Another thing that you might see is that there's big plateaus despite the most amazing compliance, right? Because you're doing everything that your providers, your specialists, your functional medicine, your protocols have recommended, and you're doing it perfectly, but progress stops cold or sometimes even reverses. Maybe, especially if you live in Houston, right? You know that there's maybe some water damage, some leaks, maybe you smell some musty odors. So, any history of flooding or slow leaks, or basement dampness, bathroom moisture issues, or that distinctive musty smell in the house gives you an idea that there may be mold and mycotoxins present. Another big thing that you'll see is that detox protocols oftentimes make your kid worse. So when you try binders and glutathione or other detox supports and your child regresses, this is a big sign that the nervous system cannot coordinate that detox process. But the most important indicator is that you're doing everything right nutritionally, therapeutically, and medically, but they're still stuck. So, this is what needs to happen for your child to actually heal from mold toxicity. We absolutely need to remove the environmental exposure for sure. So, finding and remediating the mold. So, professional assessment and proper remediation. This stops new damage from occurring and it removes everything out of the environment. But then we have to repair the nervous system. And this is the step that gets skipped entirely. And it's why kids stay stuck even after remediation, even after detox protocols. Because neurologically focused chiropractic care specifically addresses the stress and the subluxation, especially within the upper neck where our brainstem and the vagus nerve are, where they're the most vulnerable. It restores proper nervous system communication. It shifts the autonomic nervous system from that sympathetic dominance or gas pedal to more of our balanced state where the brake pedal's turned on. We start to rebuild vagal tone. A big part of that brake pedal actually starts to turn back on, where we're reestablishing parasympathetic nerve function. And then we start to restore the body's ability to coordinate, to detox, and the immune responses and healing can actually take place. But the thing that we do different when we start comparing to functional medicine is we actually use what's called the insight scans. Now, this allows us to objectively measure what's going on within the nervous system. So, heart rate variability shows us whether the nervous system is stuck in fight or flight or if it can shift into rest and repair mode. So, are things super wound up or are things very depleted and exhausted? Now, the thermal scan, this is one of my favorites for mold, is it's actually revealing patterns of inflammation and autonomic nervous system imbalance all the way along the body. And the last one, this is a big one for our mold and our detox and our elimination type cases, is what's called surface EMG. Now, this was what measures neuromuscular tension. It actually shows us where things are exhausted and where dysfunction is taking shop. Now, these scans show us exactly where the nervous system is stuck, and it allows us to track the repair process over time. And then, and only then, do we then support detoxification. Because once the nervous system is repaired and can actually coordinate the detox pathways, then gentle detox support can work. Not before. And most parents and providers skip step two, and then it goes straight to remediation or from remediation to detoxing. And this is why kids don't get better, or oftentimes why kids get worse. Because you cannot ask a dysregulated nervous system that's using all of these resources for survival mode to then detox. It's not a priority, and it's going to fail every single time. But here's what happens when you actually get the sequence correct. Because when families address mold toxicity in the correct sequence, remediation, nervous system repair, and then detox support, we see transformations that seem impossible to parents that have been stuck in this for years. And this is what we typically see when the nervous system is properly repaired. Within weeks, we see some changes to their congestion. Sometimes it happens within days or immediately. Sleep starts to normalize. Their energy is returning, behavioral regulation improves, and actually the sensory tolerance increases. And within the first months, we see things like anxiety and brain fog lifting. Their immune function is actually strengthening, meaning their flares are lower, there's fewer illnesses that are coming about. Digestive issues actually start to regulate. Their immune and their emotional regulation starts to stabilize. And oftentimes, when these kids, you'll see developmental progress resume or even like skyrocket and accelerate. And for some of these really intense cases, you see the seizure thresholds actually normalize. Now, scans confirm what parents are seeing. Our HRV scores will climb and they'll stabilize. The thermal scans show inflammation clearing from the body, and the EMG patterns start to normalize and show symmetry because the nervous system shifts from survival mode into growth mode. And this is the critical piece that parents need to understand through this is that healing doesn't happen if you skip nervous system repair. Because you can remove every speck of mold from your house and you can do every detox protocol known to functional medicine as perfectly as possible. But if the nervous system is still stuck in sympathetic dominance and there's vagus nerve dysfunction and stress and subluxation creating interference, your child's body cannot execute that healing process. So I'm going to be blunt because parents need to hear this. Functional medicine has done incredible work bringing awareness to environmental toxins, to gut health, and to root cause approaches. But there's a massive blind spot when it comes to the nervous system. And most functional medicine providers will test for the mold exposure, they'll recommend remediation, and then they'll immediately start detox protocols, throwing supplements at symptoms and miss the nervous system dysfunction entirely. And this is why families will spend thousands upon thousands on functional medicine protocols for mold toxicity and see minimal results where their kids actually get worse. Now, the supplements, they're not wrong. The testing isn't wrong, but the sequence or the batting order is incorrect. You see, the nervous system controls whether your child's body can actually use those supplements. They can execute those detox pathways and coordinate the healing responses. But when stress and subluxation creates that interference and the autonomic nervous system is stuck in sympathetic dominance, it actually doesn't matter how many binders, how much glutathione, or how clean the diet is. The broken nervous system cannot coordinate the processes that you're asking it to run. So, this is not a criticism of functional medicine. It's a wake up call that the nervous system must repair first. So, you wouldn't try to run a marathon on a broken leg. You wouldn't ask a car with a seized engine to win a race. So, you cannot ask a dysregulated nervous system to detoxify effectively. If your child's been exposed to mold, or if you're suspecting that mold might be an issue, this is what you need to know. Remediation alone isn't enough. Detox protocols without nervous system repair will fail and oftentimes make things worse. So the nervous system must be repaired first, or nothing else you do will work the way that it should. And here's what I want you to do. If you suspect mold is sabotaging your child's health, send us a DM or comment the word neuro below. And we're going to send you the mold investigation checklist, the red flags that indicate nervous system damage from mold, and why neurologically focused chiropractic care is essential before detoxing, as well as how to find a qualified pediatric neurological chiropractor. And if you're in the Houston or Katy area and you're ready to get your child's nervous system scanned to see exactly what's happening and what needs to be repaired, check the link within our bio. Now, the scans, the consult takes 10, 30 minutes, and it reveals the hidden dysfunction that are keeping your child stuck. And if you're already remediated the mold, but your child's still struggling, the answer isn't another detox protocol. The answer is repairing the nervous system damage that the mold created so that your child's body can finally do what it's designed to do, which is heal. So the sequence matters most. We got to remove the mold to stop new damage. We got to repair the nervous system to restore the body's ability to heal and detoxify. And then we need to support detoxification because now the body can actually respond. And if you skip step 2, you'll stay stuck no matter how much money you spend on supplements and protocols. You see, your child's nervous system was designed to heal, but it can't heal when it's trapped in sympathetic dominance, with stress and subluxation creating interference and a vagus nerve dysfunction that's shutting down the detox pathways. So let's repair that foundation so that everything else that you're doing can actually work.